Good morning, all. Today's topic is biomimetic dentistry. So, biomimetic restorations are restorations that mimic nature. That is, a biomimetic means to mimic nature, a term initially popularized by Pascal Bacne in his 2002 book Bonded Porcelain Restorations and Anterior Dentition. The goal of biomimetic dentistry, also known as biomimetic restorative dentistry, is to restore teeth with decay or cracks to their natural strength and structure. The biomimetic principle, that is the idea that the intact tooth is the guide to reconstruction. Definition: biomimetic restorative dentistry is a restorative approach that aims to mimic the natural tooth structure, function, and appearance when repairing or replacing damaged teeth, focusing on preserving tooth structure and using materials that replicate natural tooth properties. So, traditional crowns and harmful full cuspal coverages. Traditional retention foam crowns are secured to the tooth by mechanical retention, which means a tooth will be cut into specific ferrule shapes regardless of the pathologies. The thought was that this retention stabilized any cracks in the tooth to stop them from propagating. But unfortunately, the opposite was true. Stresses of occlusion in traditional crowns are directed directly to the cemento enamel junction, causing pain for patients as the crack grows larger. So, this picture shows tooth circle of death. Here, after several attempts of restoration and finally RCT and post-in-core restoration, tooth root fracture or catastrophic fractures occur to the tooth and tooth eventually cause for extraction. This cycle of death can be prevented by the application of biomimetic dentistry. So, according to Summit, if a cuspal coverage is needed, a full coverage crown is considered the least desirable treatment option. So, here in biomimetic dentistry, we are trying to give restorations in the same way as the other tooth as a guide. Contralateral tooth we can take as for guide, and we can plan restoration in such a way. So, certain concepts about biomimetic dentistry is biorim, biodome, etc. So, what is a biorim? Teeth have two functions on the biodome and a biorim. The biodome is the coronal half of the tooth, and the biorim is the cervical half of the tooth. Biorim is very important tooth structure that we should preserve. It is the 2 to 3 mm of the tooth structure located above the position of the CJ. Teeth naturally hate tensile stresses and they are designed to function in compression. So this figure shows this is the height of contour above which it is biodome and below which it is biorim. This area demarcated with red color shows the biorim. So what is happening is this figure shows the stress patterns in the natural dentition. Here we can see the forces that acting on the enamel, that is the primarily tensile forces, vertical forces. When it is changed to when it is transferred to dentin through the DEJ, the stress pattern changes. That is, the primary tensile forces acting on the enamel is changed to compressive forces, that is, horizontal forces when transferred to dentin. And also, there is stress concentration in the cervical. The more number of lines we can observe in the cervical area, the stress concentration in the cervical area. So, The enamel on the tooth acts like a compression dome, much like the dome of a cathedral. With an overlying enamel compression dome, the underlying dentine is protected from damaging tensile forces by helping transmitting the compressive forces to dentine when a load is applied, therefore reducing the damaging tensile forces. In relation to the compression dome concept, the biorim forms the base of the dome and therefore preservation of the biorim is important. Once biorim is disrupted or removed by traditional crown preparation, the underlying dentine is exposed, which in turn will be subjected to tensile forces that exceed the natural design parameters, where disruption of compression system will lead to significant shift in load pathways. These forces lead to crack propagation, causing flexural pain, failure due to cyclic flexing of dentine, and eventual fracture and loss of tooth structure. It is very important to preserve the biorim whenever possible unless there is an existing damage from previous restorative efforts, trauma, or decay. In biomimetic dentistry, the biodome takes the form of a ceramic onlay or overlay which is adhesively bonded to preserve biofilm. For a long time, crowns were considered the best restorations for severely compromised teeth. Disadvantages of crowns are that they require sufficient ferrule and that the outline should be extended considerably towards the cervical region, which may result in loss of more tooth substance. The costs for crowns are considerable, therefore, some restorative dentists recommend alternative concepts. Furthermore, traditional crown preparation cut many sound areas that have never been attacked by caries.